instrument, and you are going to hear the next case in the meantime. Okay, we're going to do it without the jingle now. I've got another 79-year-old male patient we would like to show you. He had epigastric pain, and in the CT scan we found a mass lesion close to the pancreatic head with a diameter of about 4 centimeters. We're now going to do an endosonography and an EUS guided fine needle puncture FNP, and Dr. Schachschal and Heinz and Niels are going to show you this intervention. When it comes to the FNP, we all have our own preferences and techniques, and today we would like to show you 2 Medtronic needles. We have one standard needle and the so-called beacon needle and the shark core needle. So we've got both here. I would like to show you both of them. This is the endosonographic finding with an Hitachi instrument. This is where the arrow is, the extended pancreatic duct, and if we follow it, then you see that it ends up in this hypoechoic area, which is the mass lesion where we're going to do the puncture. So we've got one needle, that is the standard needle position in the red suction needle. The needle is filled with saline. We are positioning it now, so we'll come into the picture from the right-hand side according to the American standard. The European standard would be from the left. There are different preferences when it comes to the standards too. And we'll now try to get it close to the tumor. And we see that the patient, of course, responds a bit to the needle, but if you move a little like this, it's not that easy to get good control of the needle tip. So the needle has a special shape. It's also very visible. We apply suction now, and we've just punctured this coarse tissue. You have to apply a little bit of force with the normal needle because we don't have a stylet. And we now have to have a look at the tissue we've obtained. I'm going to reduce suction now and stop suction. You can leave the entire overtube in the system with this kind of needle and can fixate everything and pull out the needle, and you see that it comes out of the instrument, and at the very end there is a needle sheath which makes sure that the needle tip is invisible and protected. And now I can decide whether I'm happy with my 19 gauge needle or whether I would like to use a different one. Now I'm going to use the shark core needle. I'm introducing the needle into the instrument. Everything's very safe. I'm going to fixate the needle in order to make sure that it doesn't come out immediately and bring it back into the correct position. The shark core needle cannot be used with the red suction technique because it's too sharp. It would penetrate the overtube. It contains a stylet. You see that it snaps into position, and as long as the stylet is fixed, then the entire system is blunt. I have to find the right position now. This is the extended pancreatic ducts up here, so that you can find your bearings. I've taken the arrow out. This is the tumor, the mass lesion. I'm turning the stylet with a slight turn of the instrument in order to make the system active. This is the needle, and of course there are different preferences. Again, you can do a slow pull, for instance, like this. You try to control the position of the needle visually, and it's not that easy. We're not going to take the stylet out, and we're going to apply suction again. So we've got suction. This is the tumor. The needle is in the tumor. We've switched off suction. I leave the system in position, take this out and pass on the needle. And let's now have a look at the result of the puncture. Now we extend the needle out of the protective sheath and rinse it. And in the image you see the first tissue samples, and here you see with the sharp core needle that we've got little cylindrical tissue specimens. We also see these cylindrical shapes of tissue with the other needle, and I now have a look at these cylinders for histological analysis. I just collect them and put them in formalin. We don't want to compare the needles, we just need a diagnosis for the patient in order to see which bits we can use for histology. So we just try to pick up all the fragments, and we are also going to collect all the remaining fragments and pass them on to cytology, to the cytology department. And for me, this looks like a successful puncture. So that was a good FNP, and I'm confident that we'll obtain a diagnosis, and whether that is the case, we will hear tomorrow. Thank you very much. We're going to switch.